I'm Dr. Kishore Kumar, Senior Neonatologist and Founder Chairman of Cloudnine Group of Hospitals. Prematurity Day is celebrated on 17th of November every year since 2008. After European Foundation of Care of Newborns started celebration, but Cloudnine started in India in 2006, and we have been celebrating Prematurity Day from the inception, much earlier than the foundation declared the Prematurity Day. Prematurity Day is important to raise awareness of the problems of prematurity and prevention of prematurity, and the plan to make sure that babies are saved intact, not with any disability. That's the importance of Prematurity Day celebrations. Now, premature birth is something which not any mother anticipates when she becomes pregnant, and pregnancy is a wellness, not an illness. So they will be happily celebrating the pregnancy and expecting a beautiful childbirth. Unfortunately, 10 to 15% of pregnancies land up in being premature births. Now, though the technology and various aspects of neonatal intensive care has improved in the last 2 decades in a big way, prematurity is still faced with a lot of problems. So the focus has shifted in the last 10 years in preventing the prematurity. How do we prevent prematurity? With the proper antenatal care, majority of the premature births can be anticipated and prevented. I'll give you some examples. If proper antenatal care is taken and health of the mother is taken care, we can avoid gestational diabetes, we can avoid pregnancy-induced hypertension, we can avoid stress, we can avoid infections during pregnancy, all of which are known to cause premature births. Gestational diabetes, definitely if it's not controlled, can lead to early delivery. Pregnancy-induced hypertension can lead to preeclampsia and eclampsia, and proper care and avoidance of this can prevent your prevention of prematurity. Low-grade infections, rupture of membranes due to stress and various other factors can lead to premature, and that can be prevented. Some women may have or noted to have short cervix. Short cervix can be treated, anticipated well in early pregnancy with the cervical encerclage, which can prevent premature births. But most importantly, there has been extensive research lately in the last 5 to 10 years where nutritional supplement of omega-3 fatty acids to the tune of 1000 to 2000 milligrams can prevent prematurity in some women, not necessarily all women. And this is something which we should consider, especially in some women who seem to have premature births repeatedly. The last but not the least, the artificial intelligence can play a significant role. In Cloudnine, we have been trialing artificial intelligence in predicting which women can go into premature labor and who will continue to deliver a term. The prediction of artificial intelligence in our pilot project is shown to be around 75 to 80% accurate, whereas prediction by the clinician is about 20%. So in the early stages of this trial, we have definitely found artificial intelligence can play a role in preventing prematurity. So at Cloudnine, we have been struggling hard for the last few years to help women to prevent prematurity so that they can have healthy babies at full term and enjoy their childbirth. Premature birth is something which most mothers don't want it. Most clinicians don't want it because premature birth is faced with a lot of problems. And ultimately, prematurity is something which we want to prevent. And that's why the awareness of premature birth is raised every year on 17th of November in Prematurity Day celebrations. And part of this celebration is we raise the awareness that Not all places of birth are suitable for premature birth. When you are anticipating or having a premature birth, you should deliver in a place where premature birth can be taken care of very well, and a premature baby can be looked after in a place for good outcomes, what we call as the intact survival without any disability. You need four things. One is an obstetrician who is experienced in delivering a premature baby. Not all obstetricians are well versed in delivering premature babies, especially extreme preterm births. Then you need to have a team of experienced neonatologists who will be experienced to cater for looking after that sort of a baby. Then the third thing is the team of nurses and allied specialists who are experienced in looking after the premature baby. Fourth is the technology which is required, which is advanced equipments which is required to look after those sort of premature babies. As I mentioned, at Cloudnine since inception, we have been providing all these four in all Cloudnine's hospitals, so that our aim is to save premature babies with the intact survival, which means no disability. Neonatal intensive care has expanded rapidly in the last 20 years across the world, and most parts of the world have trial by error and by experimentation, and a lot of babies were born with disability in the past. In the current scenario, the focus has been intact survival, which means saving babies with no disability. And this can only happen with the advanced technology being available in the intensive care, advanced latest equipments being available in intensive care, and also identifying any problems which the babies may have with the newborn screening and predicting sepsis at an early stage. At Cloudnine, we have been using artificial intelligence to predict which babies can go on to develop sepsis, and they can predict the sepsis within 12 hours of birth, so that we can take adequate measures to prevent the problems. All these four things, that is, good trained obstetricians, well-trained neonatologists, a good team of nursing staff and allied specialists, and very good technology is essential for looking after a premature baby with a good outcome, without which you should not be delivering any baby in any hospital, because the chances of the baby surviving or having intact survival will be much, much lesser. I qualified as a pediatrician in 1989 from Davangere Medical College and Mysore University, and I worked as a neonatologist in Mission Hospital in Mysore between 1989 and 1990. At that time, we saved a baby who was 780 grams. That was the lowest birth weight in the whole of India at that stage, and every print media and electronic media at that time carried the story saying Dr. Kishore has saved this baby 780 grams. Was I confident of saving that baby, or did the baby survive on its own? I'm not sure. If somebody had asked me to replicate the success those days, probably I would have said, I don't know, I'm not sure. So that's what took me abroad, and I worked in UK, Australia and USA over the next 15 years. And I trained myself in advanced neonatal intensive care, where I became expert saving babies less than 28 weeks in Monash Medical Center, Melbourne in 1994. Since then, we have been saving babies less than 28 weeks, which is extreme premature babies, without disability. And with that as the background, we opened Cloudnine in 2006. And I'm pleased to say that the lowest birth weight we have saved in Cloudnine now is 390 grams, which is just exactly half of what I saved in 1989. And if somebody can ask me, can I replicate the success? The answer is yes. We are equipped, we are well trained, and that's why Cloudnine has become synonymous with high-risk babies being saved. And we have numerous stories of babies who are born early and being saved. Notably, when we opened Cloudnine in 2006, we had a lady who came in inquiring about antenatal classes and almost delivered the baby in the lobby. That baby was weighing only 980 grams and was 30 weeks gestation. Soon after that, when we examined the baby had a tracheoesophageal fistula. That means the breathing tube and the food pipe was connected, and the food pipe was not connected to the stomach. What it meant is the baby required emergency surgery. Even the surgeons were reluctant at that stage to operate on a baby who was less than 1000 grams, but we convinced the surgeons to operate, and today that baby is 16-year-old and working for an NGO and stood first time in mathematics in our class. Subsequently, we had another set of twins. The twins were weighing 480 grams and 540 grams, but the mother had a huge fibroid which was weighing almost 5 kilograms. And this fibroid was pressing on one of the legs of the twins, which had led to the dislocation of the twins. And because of the problem that was causing, the lady had to be delivered at earlier twins. And now both these twins are 12-year-old girls having had surgery for the knee dislocation, one of the twins. They both are beautiful dancers and leading a normal life. So I can go on telling numerous success stories of premature births having been saved in Cloudnine, which has created history by itself. No wonder Cloudnine is a success story in Indian Institute of Management, Bangalore, and also Cleveland University, Ohio, USA, because of the rapid successes we have had and intact survival we have been giving since inception.